County's Health Services Agency played host to a disaster exercise to test how quickly they could set up emergency hospitals.
Under Metropolitan Medical Response System grant funding, we were able to purchase two 28-foot trailers that contain a bunch of medical equipment and supplies, as you can see.
In the event of a massive flu outbreak or other disaster where extra hospital beds are needed, the county's public health department will need to move into action.
We're opening the trailers up and taking all of the stuff out, setting them up, letting people get the practice to be able to do that. So we'll be ready to go if we ever do have to open these trailers up in a real disaster.
Each trailer has enough equipment and supplies for the equivalent of 25 hospital beds.
Which means then that if the hospitals had to offload patients in a disaster, these shelters could be set up, or these facilities could be set up to be able to take some of those patients out of the hospitals to be able to free up some of the very precious critical beds that they have in there.
Gene Goebel works in the materials management department of the health agency.
And I've learned to help unload the van, which handles a lot of very important medical equipment and bedding and many things necessary to set up what I consider kind of a MASH hospital without surgery.
Workers from around the county would respond in the event the mobile hospitals were needed.
I would show up at the alternate site and assist in unloading the trailer and setting up the beds and making sure that the medical staff and personnel that show up to take care of this disaster have everything they need.
And although it's only a drill, someday it could mean the difference between life and death.
We take this really seriously.